Hello and welcome to Traditional Chinese Medicine. 10 diagnostic questions. Is it normal or is this a symptom? My name is Christina Kapothanasis. I'm a licensed acupuncturist here in the state of Hawaii, and I am board certified under the National Certification Commission for Acupuncture and Oriental Medicine. I am also the executive director of the Hawaii Oriental Medicine and Acupuncture Association. Today I would like to share with you some of the functions and symptoms and signs of the body and help you understand a little bit more about which signs and symptoms are actually from illness and which ones are normal. You would be surprised at how many people are suffering with symptoms that they are unaware of. I would also like to help you know what Chinese medicine is good at treating or healing. And the 10 diagnostic questions is something from ancient Chinese texts they call Shi Wen Ge, and these are similar to the Western medical patient history taking that you may have done in some hospitals today. Though the intake is not as detailed as either the Western medical textbooks have or the traditional Chinese medicine textbooks have, it is good to do that for some patients who have more complex cases. If you're coming in for a common cold, that might not be necessary, but if you're suffering from something that they just can't quite get a diagnosis for, a detailed history can be helpful. If we go over the whole poem in Chinese medicine, they say 一闻寒热，二闻汗，三闻头瘆，四闻便，五闻饮食，六胸腹，七龙八科，俱当变，九闻九病，十闻因。And then it goes on to talk about a couple other things, but I'd like to explain to you what the first part of that means in English and then go over it one by one. So, 一闻寒热, that first is asking about the heat and cold in the body, what people are experiencing. 二闻汗, secondly, you're asking about the sweating conditions of the body, how much or how little and what times of the day. You're also asking about the head and the body as a whole, any dizziness, any problems with the eyes, nose, ears, and any whole body energy level, numbness, itching, things, questions like that. 4, we'll be asking about the urination and the bowel movement. 5, you're asking about things having to do with food, appetite, different tastes in the mouth. And 6, asking about the chest, different things going on with the lungs or the heart, abdomen, different kinds of digestion problems. 7 has to do with the ears, more of tinnitus or hearing loss. 8 has to do with the level of thirst in the body and the different options that come with that. 9 is patient medical history in terms of what illnesses you've suffered from in the past, and 10 is their causes. The second part of the poem goes on to talk about what other medications that you've tried before for this problem and how they have affected you either for positive or negative. Then another very important part of the 10 diagnostic questions includes asking females about their gynecological problems in their menstrual cycles. And last of all, it talks a little bit about children and some of the problems that they may have. So we are going to focus more on the first part of the poem and the female gynecological issues. If we try to go through these one by one and first of all tell what normal is, and then we will see some of the abnormal symptoms and see which category you may fall into. If you do fall into one of the abnormal ones, I'd urge you to look into this further, give your local acupuncturist a call. Give us a call. If we're not near you, maybe we can find somebody near you to help you. And this can help alleviate symptoms that you are experiencing now to help prevent things that may happen in the future, or it may help you relieve some symptoms that you are aware of as symptoms and help treat or alleviate those now. So let's get started with number 1, 寒热, hot and cold. We should not be excessively afraid or have aversion to cold or heat, though there are people who constantly are bringing sweaters with them, or their feet or hands are always cold no matter what the temperature is outside, and this is usually a yang deficiency, though yin deficiency can also present like that. We also do not want to be excessively hot, and you can compare yourself to those around you. If everyone else in the conference room is also wearing a sweater because they have it down to 50 degrees, then you are not yang deficient. But if you are the only one wearing a thick sweater and everyone else has on t-shirt, then you can gauge how hot or cold you are to the general population. Others are constantly hot, red-faced, sweating, wanting to drink ice water. This kind of excessive heat is also one thing that I find a lot of people here suffer from. It's either they're too hot or they're too cold, and here in Hawaii I find a lot of the heat patterns, whether it's excess heat or deficiency heat, excess heat causing the excess feeling of heat in the body, and the yin deficiency actually causing a lot of the cold here in the islands. The second one is han, or sweating. What is normal sweating? Normal sweating is you can sweat a little after a brisk walk or a little exercise. Hopefully you can sweat a little bit on your brow or maybe even on your forearms. But if you are in a line of treadmills at the gym and everybody is running away and your shirt is dripping, your face is dripping, and everyone else is having mild sweat, or if you aren't doing any heavy activity, maybe you're just doing light housework or light yard work and you're completely drenched, then we know that you have excessive sweating, which is usually due to an excess heat. Can also have damp heat condition, which is not normal and could be helped. I have so many people who come in hot. Their spouse may say that they're hottie and they don't even want to get near them in bed at night because they're steaming, and we cool these people right down and help with a lot of other symptoms too. It's nice to see people come back wearing more appropriate, maybe t-shirt or long sleeve shirt for the weather. No sweating, on the other hand, is also a problem. People are sometimes happy at the convenience of not sweating, but actually we do need to sweat a little. If you exercise and exercise intensely and cannot sweat, that may be a problem of the, we call toli, a pore translation is the pores of the skin not opening and closing properly. It may be an external problem, or it may be a yin deficiency. If you don't have anything to sweat, then we need to hydrate you. Other than just drinking water, we need to nourish the yin so that you can sweat. And finally, night sweats. Night sweats are when we sweat when we're sleeping. Some people wake up and their whole t-shirt is soaked or nightgown and they need to change, sometimes more than once per night, and sometimes it's just around the neck or the forehead. And though you may say, I sleep with warm covers and that is the cause of my night sweats, not really. We would like to help with the night sweats, and those are usually yin deficiency problem. If during the day you do a little bit of movement and you're sweating really easily, especially all of a sudden, as opposed to a menopausal hot flash where they feel a well of heat, that's different. But if you just burst out into little sweats very easily, we say during the day that is a qi deficiency problem. So all of these are not normal manifestations of sweating, and hopefully if you fall into one of those categories, you can think about correcting that. The third one is pain. Now, most people know when they're in pain that this is abnormal, especially if it's high on the pain scale from 1 to 10, 10 being extreme pain. People may tolerate, though, or live with a lot of pain that could be helped. People may say, oh, I did soccer or I did football when I was a kid, and my shoulder or my knee or my back is just in chronic pain. But that doesn't necessarily mean that you have to live with that forever, because acupuncture and some of the other therapies like electric stimulation or cupping may help dissolve those injuries, whether it be from a few weeks ago to several years ago, 20, 30 years ago. We've still had people who come in with 20 or 30 years of back pain or shoulder pain or knee pain, and we help them resolve that in a more permanent way. Not that we can help everybody, but a lot of people we can. So if this is something you are suffering from, please don't think that you have to, nor you deserve to live like that. Other types of headaches, pain, including headache, is definitely not normal. A lot of people suffer from headaches and migraines, and that can be easily remedied. So please do not think that this is how you have to live. Chest or rib pain, you have maybe gone to the doctor and they have said heart and lungs are fine, you've done treadmill stress test, and everything, lab tests turn out normal. You may have sharp pains, shooting pains across the ribs. All of these things may be classified into subhealth, not an official diagnosis in terms of Western medicine, but Chinese medicine is subtle enough that it should be able to help with things like that. Lots of different abdominal discomforts that they have no diagnosis for, and anything having to do with upper back, lower back, neck pains, legs, arms, hands, and feet. Plantar fasciitis is another condition that lots of people don't really realize that they have. That's feet pain. There's usually accompanied by a burning, sometimes severe, but sometimes not, tight tension, and when you walk, it can get worse. So this can sometimes also be accompanied with cramping. Some people experience cramps in the middle of the night. All of these things can be helped, and you can feel much better and be relieved from these things that take down your energy and distract you from things that you would probably rather be focusing on in your life. When it comes to head, body, abdomen, and chest, we will consider things like dizziness. People think, oh, after I exercise, I stand up and I'm dizzy. In the morning, I stand up and I'm dizzy. That's okay. I just wait a couple seconds for it to go away. But this is the beginning of symptoms which should be looked at before they develop into something more severe. Palpitations is another thing people will feel after they exercise in the middle of the night. And if their EKG says that nothing's wrong, they may just ignore this. But Chinese medicine, especially put with the symptoms, tongue and pulse diagnosis, can be excellent for helping relieve those conditions. Many abdominal discomfort, bloating gas, you do not have to live with any of that, and you say, oh, it's just accompanied with what I eat. Yes, it very well may be, and maybe it would be easy to avoid the foods that cause that, and pinpointing them can be helped by your local acupuncturist. Acid reflux is another major irritant to people these days, and you do not have to suffer with that. And please do not think that taking the antacids for the rest of your life is a good solution. Numbness, heaviness, sluggishness in the body, all are symptoms that can be avoided. Numbness probably people would recognize more as a symptom unless the doctors have done all they can and you're left with mild to severe numbness, which can be helped and relieved by acupuncture or cupping. When it comes to ears and eyes, tinnitus, which is ringing in the ears, is not normal. I think most people would agree with that, unless they have been exposed to loud noises for example, during the wars or loud music when they were younger. But some tinnitus, especially if it's just started and you haven't been exposed to loud music or loud sounds, can be helped with Chinese medicine and acupuncture. So if you have mild tinnitus and the ear, nose, and throat doctor and other doctors haven't found a explanation or treatment, I encourage you to give traditional Chinese medicine a try. Eyes. So many people, especially here, suffer from itchy eyes, burning eyes, dry eyes, whether that be from contacts or the fog, which comes from the volcanoes on the Big Island. Eye itchiness is a huge problem here, and you do not have to suffer from that and think that it is part of life. Sleep is probably the biggest thing that people do not pay attention to. What is normal? Normal is sleeping through the night, sleeping well, feeling refreshed after an 8-hour, total 8 hours night, not getting up in the night to urinate or maximum of 1 time. I would say that 90% of people's sleep is not that ideal, but they may suffer from trouble falling asleep. If you fall asleep within 15 minutes of lying down, that is still normal. But if you're tossing and turning for an hour or more, that is not. If you're waking several times during the night, some people always wake at the same minute, same hour every single night, trouble falling back asleep, waking up earlier before the alarm clock goes off and ready to go, but know that you're not fully rejuvenated. All of those things are not normal. We hope that you would get a restful night's sleep, because the yin, the part of the night, the part of the yin-yang symbol, as everybody's probably seen, especially here on the TCM Surf Shop, this is actually Chinese medicine, diagnostic principle, and the yin is the blood and the fluids, the calming properties of the body that are replenished at night, and they are very important for our overall health. So getting to sleep at night is something we don't put enough emphasis on, knowing how many people come in and say they get 5-6 hours of sleep a night, or staying up very late into the night. Next has to do with food, thirst, appetite, and tastes in the mouth. There are different examples of thirst. So it is normal to be thirsty sometimes during the day, and we would try to get down as many glasses of water, ideally 8 cups a day if possible. Now, we do not count things that have caffeine in them or alcohol. So some people say they come in, they have a coffee, they have a green tea, they have a soda. Unfortunately, these beverages do not count in our water intake for the day. But some people are not thirsty at all. Some people cannot drink water. It makes them feel nauseous. They have to have something like fruit juice or Coca-Cola. These are usually problems with either yin deficiency, it may be something with dampness, damp heat in the body, or a more excessive water condition, water metabolism problem. If you're always thirsty at the other extreme, this is another problem. Some people cannot leave their house without an ice cold water bottle. And this is also not good for the body. It's not normal to be this excessively thirsty all day long and drink gallons of water. Some people do. And it's also not good to drink the ice cold water. It damages the digestive system. So this ice cold water craving kind of person goes back with the person who is always hot and the person who is usually sweating excessively. These heat people, I love it when we can cool them right down, and they are satisfied with normal room temperature water, which would be ideal if you drink room temperature water throughout the day. Some people are thirsty, but when they put the water in their mouth, they don't want to swallow it, they want to spit it out. This kind is also a more severe kind of dampness or a stagnation syndrome in the body. Appetite. There are people that eat because food is put in front of them, though they may not be hungry. That is not ideal. Ideal is you are hungry for your 3 or however many meals you eat a day before you eat, you feel that nice hunger in the stomach, and then you eat your meal and you feel satiated or satisfactorily full and not bloated after each meal. And if you do not have an appetite, that does not mean that you are frail and withering away. You could have a normal body shape or even be overweight, but if the digestive qi is not strong, if you have a weak digestive system, then the hunger will not be there. There are also people who are always hungry, people who feel like they have a hollow, sometimes even burning sensation in the stomach, which they mistake for hunger, and that is simply a case of stomach heat. And again, we would love to help you cool down. The other thing that I run into all the time is people who crave sweets. Now, they may not think that anything is wrong, or they may realize that this isn't normal, but it isn't normal. And the easiest way to help the body overcome that is to replace the sweets with the correct cooling foods, which is actually what the body is requiring at that time. It's really asking for foods to cool you down, and the sugar cools you down temporarily but leaves you hot in the end and wanting more. Another thing people come in and don't know is abnormal is the bitter or sour tastes in the mouth. These are also abnormal, and we would like to help the stomach liver balance recover so that isn't something that is plaguing you anymore. Bowel movement and urination is another thing that people need to pay attention to every single day. People usually don't look at their stools, but it is super important to know what is normal so that you can know when something is going awry and what you need to do to get yourself back on track. Normal is going every single day. Yes, you have to go every single day. Once every 2 or 3 days or even a week is definitely not normal. You can go more than once a day. That is not a problem as long as it is long, formed like a banana and a brown color. If you're having loose stools, loose and brown, as in falling apart like applesauce, then this is a spleen deficiency. Your digestive system is deficient of qi or energy. If you have undigested food particles in there, that is also not normal. That is another sign of digestive deficiency or deficient fire in the stomach. If your stools are loose and yellow, maybe have an odor to them, this is damp heat. We need to clear the excess heat and dampness from your system to make your stools become formed again. You should also not have to sit on the toilet and read the entire newspaper. I know some people have a magazine rack or bookcase in their bathroom, but it should be very easy to go in and feel completely eliminated in a rather short amount of time. On the other hand, we also don't want you to be constipated. We do not want you to have pebbles, little rocks like coming out, or small hard chunks. And you should not have to sit there and strain and push. This can be yin deficiency, this can be blood deficiency, and we would hope that these things could be alleviated. We also don't want you going back from pebbles and hard to loose and back and forth. This usually has to do with your liver, and the qi stagnation in the liver needs to be flushed and regulated so that it doesn't come over and attack the stomach anymore. We also don't want you to wake up early in the morning before the alarm clock goes off at like 5 a.m. so that you have to go have loose stools. This is called 无根泻, and it is usually a sign of spleen deficiency caused by the kidneys not warm enough to heat the spleen so that it can work well to digest the food. So if you have spleen yang deficiency, that may be another symptom. Normal urination is 3 to 5 times a day, and it's light yellow to pale clear color. It is not normal to go very frequent. It is not normal, obviously, to have burning sensation or to have a problem with the flow or to have any control issues. Most people know that. But if it does look dark like orange or tea, this is another thing that we would need to cool you down so that your urine looks light yellow to pale. Lastly will be the gynecological part. And what we want is the female cycle to be 28 days, last from 3 to 5 days, with approximately 50 to 100 milliliters of blood per cycle. No clots, bright red color, and no pain or other discomforts. If the cycle is 21 days or 35 days, or even it's stopped and you have only a few periods per month, this may seem convenient, but it is absolutely crucial that your period come every month for your overall health. The hormones control so much in your body. If you are bleeding excessively, more than 3 or 4 pads a day, you really need to control bleeding so that it doesn't damage your liver, blood, and your kidney essence, and your menopause, upcoming menopause, will be much more severe if you don't get that under control. We do not want your periods to be dark like red wine, nor do we want you to have large clots or pain or any of the other PMS symptoms like irritability, tender breasts, cramping. Some people have loose yellow stools. Some people always get migraines or headaches. Some people always catch a cold. All of these things are not normal. And some people say, my mother said I'm being completely cleansed out. It's excellent. But it is not, and we need to help you get on track so that you can feel better and you can feel more energetic and feel more well-rounded through the day. Lastly, vaginal discharge is something you also don't talk to many of your friends about. You probably don't discuss your period flow and your clots either. So if nobody's telling you what it should be, you might not have a good idea. Normal is a little bit of clear white discharge, and it's normal to have a little bit more after your period, in between periods at ovulation, or when you're pregnant. But if you have more white, watery discharge, maybe kidney yang deficiency, excess white sticky may have something to do with spleen dampness or spleen problems. And if it's yellow, sticky, or if you have any itchiness down there, also not normal, and you don't have to suffer with that. So I hope that we have gone through a very comprehensive explanation of what is normal and what is not normal. And if we can be of help or find somebody near you that can be of help to you, just give us a call. Thank you so much for watching, and mahalo!